your student nurse for today. Can you please verify by stating your complete name? How about your date of birth, ma'am? So today, we will conducting an assessment on your skin, head, and neck to assess your health status. Any significant findings will be cascaded to your doctor for the next course of the action for your treatment plan. So is it okay with you, ma'am? Okay. So before that, I'm going to provide privacy first. So before we begin, ma'am, I'm going to perform hand hygiene first. Today, we're going to perform an integumentary assessment to the patient. And to do this, I will start the cephalocodal approach. I'm going to assess the skin color of the patient, the vascularity, signs of bleeding, bruising, lesion, scratches, scars, wound, and identifying marks. But before that, I'm going to wear gloves because I'm going to palpate the skin of the patient. Alright, Miss Danica. So first, I'm going to take a look at your face to look any signs of scars, lesions, or masses. For the findings, the skin color of the patient is fair, and there is a mole on the patient's right eyebrows, and there is a signs of hyperpigmentation due to acne marks on both sides of the cheek of the patient. There is a scar on the left eyelids of the patient, as you can see here. Next is I'm going to assess the patient's neck, and I'm going to look for any signs of bruising, lesion, scratches, scars, wounds, and also the skin color of the patient's neck. For the findings, as you can see, the color of the patient's neck is the same as the skin color of her face, and there is a mole on the lower part of her jaw, right here, right part, and there is no signs of any bruising, lesions, or wounds. And now I'm going to assess the anterior thorax of the patient, and I'm going to look any signs of bruising, lesion, scratches, scars, and any wounds. And I'm going to use this cloth to drape the patient for privacy. So, Miss Danica, are you ready? I'm going to assess your anterior thorax, and I'm going to use this to provide your privacy. Is that okay with you? For the findings, the areas that covered most of the time appears lighter on the chest, abdomen, and the upper shoulders of the patient. And there are no signs of any bruising, scar, or lesions on the patient's anterior thorax. Now, I'm going to assess the upper extremities of the patient, and I'm going to look on the skin texture, the skin moisture, skin turgor, and skin temperature. And now I'm going to assess the skin texture of the patient. Next, the skin moisture. And then the skin turgor. Then the skin temperature. for the findings, a mole is noted on the patient's left upper arm, which is about 0.1 centimeter, and there is a scar on both hands of the patient under the elbow, which is 1.5 centimeter, and also on the right upper arm of the patient. Fine body hair evenly distributed on the patient's body. Skin is warm to touch, smooth and dry, and skin turgor is good. And now I'm going to assess the nails of the patient, and I'm going to look its color, shape, the angle, and if there is signs of clubbing, and the capillary refill time. So Ms. Danica, I'm going to assess your nails. For the findings, the nails are short and clean, nail bed appears to be pink, the capillary refill time is less than 3 seconds, no lesion, bruisings, and sign of bleeding is noted on the patient's body. Now I'm going to assess the lower extremities of the patient and the posterior thorax. I'm going to use this cloth to drape the patient's body to provide privacy. So for the findings, there are no lesions, bruisings, and signs of bleeding is noted on the patient's body.